COVID-19 is now present in every continent except Antarctica. China, where it originated, has been dealing with it longer than any other country. Roni, Caryn, Rabin reported for the New York Times that Chinese Center for Disease Control and Prevention published the largest analysis of COVID-19 cases to date. Here are some of what she reported. The disease poses a particular threat to middle-aged and older adults, especially men. Men and women have been infected in roughly equal numbers in China, but Chinese researchers found death rate among men higher compared to women. This is what was seen with both SARS and MERS outbreaks, which are both caused by coronaviruses. More women than men were infected by SARS in Hong Kong in 2003, but death rate among men was 50% higher, according to a study published in Annals of Internal Medicine. 32% of men infected with MERS died compared to 25.8% of women. Men appear weaker than women in mounting an immune response against infections in general. Dr. Sabra Klein, a researcher at the Johns Hopkins Bloomberg School of Public Health, said this is a pattern we've seen with many viral infections of the respiratory tract. We've seen this with other viruses. Women fight them off better. Estrogen appears to have a role in immunity, and women's 2 X chromosomes contain immune-related genes. Men have only 1 X chromosome. Lifestyle also appears to be a contributing factor. China has the largest population of smokers in the world, nearly 1/3 of the world's smokers. 40% of tobacco consumption worldwide. Only about 2% of Chinese women smoke. Compared to women, men in China have higher rates of type 2 diabetes and hypertension, which increase risk of complications when infected with coronavirus. Chinese researchers found people whose diagnosis was delayed until a more advanced stage of the disease or had severe pneumonia when they were first diagnosed were at greatest risk of dying. Early detection is important. Several studies found men, even healthcare workers, are less likely to wash their hands or to use soap compared to women. Misleading stories, advice, and products are spreading online. Here are some things you should know. There is currently no cure for COVID-19. Antibiotics do not work against viruses. Antibiotics work against bacteria. Although hand sanitizers are antibacterial, according to the CDC, hand sanitizers with at least 60% alcohol are effective against coronavirus when you use them to clean your hands. Thermal scanners cannot detect people with the coronavirus, according to the World Health Organization. Thermal scanners are effective in detecting people who developed a fever. They cannot detect people who are infected with the virus but are not yet sick with fever. It takes 2 to 10 days before people who are infected to become sick and develop fever, but they may be infectious during that time. COVID-19 does not affect only the elderly. People of all ages can be infected, but older people and people with medical conditions like asthma, diabetes, heart disease, and cancer appear to be more vulnerable to becoming severely ill with the virus. The government is not planning to put us under martial law using the National Guard. They will not take away everyone's guns. There will not be forced vaccination forcing everyone to be vaccinated. According to Newsweek, in some parts of the U.S., gun stores are reporting a sharp rise in Asian people purchasing firearms to protect themselves. On the New York subway, an Asian man was sprayed with air freshener by a man afraid he was going to be infected by the Asian man. More on COVID-19 in my next video.